So remember, the first type of test is the Chem7, then glucose panel. The glucose panel is the test purpose is to check for diabetes, which is indicated by elevated levels of glucose. Under the glucose panel, we have the fasting blood sugar, which is the FBS. We have the 2-hour postprandial, which is after eating glucose. We have the glucose tolerant test, which is the GTT. And we have the glycated hemoglobin, which is the HbA1c. So those all fall on the glucose panel. The next panel is electrolyte panel. The purpose of that test is to evaluate levels of ions in the blood, which indicates various conditions. So under that, we're testing, we're looking for the potassium, levels of potassium, level of ion in the blood. So potassium, so the ions in the blood would be potassium, chloride, sodium, and bicarbonate. That's what we're testing when we test for electrolyte panel. So we're testing for the level of potassium, chloride, sodium, and bicarbonate. Now, the next test is the liver function panel. Now that test, the purpose of that test is to assess liver function and health. So under the liver function panel, we're testing the function. So we're testing enzymes and bilirubin. So enzymes and bilirubin would be ALP, which is known as alkaline phosphatases, and ALT, which is alanine aminotransferase, and then AST, which is aspartate aminotransferase. Then GGT is gamma glutamyl transferase. So remember, anything on the liver function panel, which is the enzyme and bilirubin, is going to end in ASE. Now, on the renal function test, the purpose of that test is to assess the kidney health and function. So renal is kidney. Liver function is the liver. Electrolyte is the level of ions. Glucose panel is diabetes, the sugar. And the Chem7 is basic organ function. So Chem7 would be 1, 2, 3, 4, 5, 6, 7. So Chem7, when you test for Chem7, you're really checking for glucose, electrolytes, liver function, renal function. So when you're doing a Chem7 test, that tests all of these. It tests for diabetes, electrolytes. It tests the liver function, kidney function, the heart function. It checked for heart attack, and it checked for cardiac and stroke. Right, so that's Chem7. So under Chem7, you could just check for all 7 tests, or you could just check for whatever is bothering the person. You could do a liver function test if the liver is bothering them, electrolyte test to whatever. So that's how you're going to understand this part. Now, under renal, you think it mean the backside, like anal, but no, renal means kidney. So renal function test is to assess the kidney function. So under that, we have the BUN, B-U-N test, which is a blood urea nitrogen. Of course, you know that's going to be on the kidney test. We have the creatine, which you know that's kidney. Creatine clearance. We have the phosphorus and calcium. And we have the protein and total protein and the albumin. And you know all of that. The next one is the coronary risk panel, which assess risk of heart disease. So cholesterol and triglycerides. So we test the HDL, which is the high density lipoprotein, and the LDL, which is the low density lipoprotein. And then the next test is the myocardial infarction screen, which is the MI. This is the purpose of this test is to assess occurrence and timing of a heart attack that has already happened. So under this we test AST, which is creatine, creatine kinase, which is called CK, and then we check for CK iso enzyme, which is also known as lactate dehydrogenase, LDH, and then troponin, which is also known as cardiac enzyme. So troponin is known as cardiac enzyme. And the next test under the Chem 7 is Lipid Panel, which is used to assess risk of cardiac event or stroke. So under that we test for triglycerides, cholesterol, LDL, and HDL.